another session of our New Normal series. I'm Dolly Begum, your MPP for Scarborough Southwest and the Critic for Early Learning and Childcare. And today I have a very special guest all the way from London-Fanshawe joining us in Scarborough virtually. I am so excited to have my friend and the MPP for London-Fanshawe, Theresa Armstrong, with us today. Teresa is also actually the official opposition whip. So as the deputy whip, I actually get to work with Teresa almost every single day when we're in the house. We're the first ones in to have our house meetings early morning, and I have gotten the chance to learn so much from Teresa over the past years. Someone I've been admiring for the work that she's been doing since 2011. So Theresa Armstrong was actually first elected in October in 2011, and it currently serves as the official opposition critic for long-term care and home care, an issue that we've been talking about a lot in Scarborough lately. We have a large number of homes in Scarborough Southwest and across Scarborough, and we know what's happening across the province, or frankly across the country, with long-term care. And Teresa has been fighting hard as the critic for long-term care and home care in the Ontario legislature throughout the past years, even before COVID-19. We know that COVID-19 has highlighted a lot of the issues that we see in our long-term care homes, but the issues that were there even before, she's been fighting hard and actually authored the Bill 13, something that we have talked about with many of our constituents in Scarborough Southwest as well. And that bill is called the Time to Care Act, which is sitting in committee, and we're working hard. Teresa is fighting hard to make sure that this bill passes as soon as possible. So I'm very, very excited to welcome Teresa to join us today. Teresa, I'll pass it to you to say hello, and we'll get started. Thank you for joining.
No problem. Thank you so much to everyone this evening. Really, really excited that I'm here and able to, contribute to the discussion of long-term care. Some of the things, of course, that Dolly mentioned, I've seen long-term care develop over the years through governments, and it's really just gotten worse. So right now, province-wide, there's been over 3,400 residents that have passed. Today, just 24 deaths in long-term care. And instead of acting quickly, this government has chosen to downplay the crisis, but we know that staff are doing their best and they are exhausted and they're at their limits, and families are worried and residents are very scared. So recently, if you in Scarborough, you've had your challenges as there's been challenges throughout the province. Just today, Roberta Place is one of the next long-term care homes that's in crisis in Barrie. There's that UK variant, and it's made its way into the home, really having a devastating effect. There's been no new measures that have been announced to mitigate the spread of the variant that's known to be more aggressive. And according to recent reporting, the ministry inspectors went into the home as recently as early this month and reported significant failings to safeguard staff, residents, and yet the ministry has chosen not to intervene. So we have lost to date 11 staff in the long-term care sector. And over the weekend here in London, the young man named Yassine Dabi, 19 years old, a long-term care worker, he and his family came to this country in search of a better life, and the system, that trying to, move into a better situation. But what we see is the system often takes advantage of racialized folks, and particularly women, by overworking them and underpaying them. And one thing we have been discussing is to overcome this crisis, we urgently need to have routine surveillance testing for staff. That is so important, and residents. Vaccinations by the end of this week needed to happen in long-term care, and we've been calling for that. 10,000 new staff need to be trained and sustained and hired in long-term care. IPAC specialists need to be in each home in order to make sure there's the reduction of infection control. Inspections in homes with teeth that can actually be enforced. And we've been also pushing for paid sick days. But unfortunately, meanwhile, the Ford government continues to sit on billions of dollars that could be used to help solve those problems in long-term care I just went over. But the NDP has been building a better system overall, and we've looked beyond this crisis. We're looking to the future as well. When hopefully we get through this much quicker than we've anticipated. But in the future, we want seniors care in this province. It should be able to allow people to age with dignity. And that means home care investments to stay home longer, that 4.1 hours of care per resident per day, enshrined caregiver rights, an office dedicated to seniors, like an advocate, a seniors advocate, and then also permanent wage boosts for staff, so they have living wages and benefits and full-time hours, removal of profit from care, accountabilities for homes that have failed to meet the standards, and early reporting or yearly reporting on assessed needs of the population to inform future investment. If we don't keep track of those statistics in order to meet the needs of our future seniors, then we're not continually putting the right investments to allow seniors to live in dignity. And quite
policies.
Yeah, and that's exactly it. You have to have evidence-based to inform policy. And quite simply, the system is broken. It's been broken for quite some time. We've all known that. And it doesn't provide quality of care, and it's not economically sound. So that is something that, as Dolly said, I've been speaking about. And more recently, I presented a bill in the legislature called Time to Care Act. And on February 5th, it'll be 100 days since my bill passed a second reading. And since then, we've been announcing, or the government, has announced 4 hours of care, but they're projecting they want to do that by 2025. The Ford government hasn't made any moves to make that a reality. There hasn't been any investment into the recent budget for that announcement. There's not a hiring spree. They didn't, do what provinces like Quebec and BC did and hire PSWs and frontline workers. And there's no mechanism to hold homes accountable when they don't provide that minimum of care. And that's what the Ford government is saying, an average of 4 hours minimum. But my legislation says we need to actually enshrine that in legislation so that it actually makes homes accountable to providing that 4.1 hours of care. A little bit of history. My carers in 2003 took it out. It took out the minimum care, and subsequent governments since then have failed to reinstate that legislation in order to mandate minimum hours of care. And so what we've seen is the erosion over time. And so when there's no legislation to hold, especially for-profit homes accountable, we're seeing the high rates of the outcomes of the care and long-term care. The fatality rates under COVID, I believe it's 78%, are more likely to pass away or have bad outcomes in long-term care. So I ask everyone, and Dolly's been doing a wonderful job. You have an excellent representative in Dolly. And I ask everyone to join me on February 5th on a hashtag social media campaign, hashtag Time to Care Act, to remind this government of their promise to bring back legislated minimum standards of care. They supported the bill, so definitely it needs to be enshrined in legislation. A little bit about London. I mean, in London, we've been fairly lucky. We haven't had major outbreaks in long-term care homes, but still constituents have called me and still contact me about, their parents who was left in a room where someone else was tested positive. And, the resident was sharing a room with that person. They contacted the family members have been contacting me, unsure of whether to bring their parent home or not. They've contacted me about inconsistency with visitor rights across homes. And the list goes on. So even though the outbreaks in London haven't been as horrible as throughout other cities like Scarborough and Barrie, we still see those problems, and I've heard those problems throughout the time that I've been elected. So last week, one of the other issues that came to light in London, I was made aware that due to a short supply of vaccines in London, the Middlesex London Health Unit was really forced to have to make these decisions and prioritize which long-term care residents would receive that would be vaccinated and which wouldn't, and which ones wouldn't. Someone had called and said that they were told that because their loved one had COVID and was COVID positive and had gone through it, that meant residents would not be vaccinated if they previously had COVID. So long-term care residents should always be our number one priority for vaccination, but this government has chosen not to prioritize, the residents over the expediency expediting this. So that's some of the stuff that's been going on in London on my end. And it's just long-term care, as we know right now, this pandemic has exposed all the shortcomings that have been there for years. And I'm just so delighted that I'm here with Dolly to talk about it and, hear from you and give some feedback on some of your comments or questions. So thank you so much, Dolly, for having me on. And I look forward to the conversations going forward this evening.
Thank you so much, Teresa. And we already have folks joining us. I want to give first, thank you so much for joining me on this conversation and for the fight that you've been fighting for so long. And you're right, the result of the 3,400 deaths, the lives that we have lost, all of these, and then the many cases of abuse and neglect that we've been hearing about. This goes way back, and we know the reality. And I want to give a big shout out to the voices of LTC and all of the family members who have been advocating for their loved ones. You all have been doing an incredible job, and I salute you. I cannot thank you enough for the work that you've been doing. And I know that Teresa talked about the hashtag Time to Care Act. Online rally that we've been doing, we'll be doing in February. And I look forward to you all joining as well. And I know you'll be supporting Teresa for that. And a big shout out to Maureen, who joined as well. And folks have already been commenting, and I appreciate all of you who have tuned in. Teresa highlighted quite a few things. And I just want to kind of go back a little bit and say, there is about $4 billion per year that goes into long-term care. We have over 600 homes across the province. And since 2000, we're talking about the former PC government with Mike Harris, and then we had, obviously, with McGuinty or the Wynne government, we really saw no improvement in terms of investment or strategic investment. There is one thing about just throwing money into something to solve a problem, but also the fact that we have for-profit homes that haven't really learned any lessons from the problems they have caused, and frankly, the inspection reports that have shown some really horrendous behaviors and trends in many of the homes. One of the things that shocked me, Teresa, was since 2000, only 2 long-term homes have had their licenses revoked. Only 2. And we know from the many inspection reports, there has been so many cases of issues where inspectors have come out into the media and said, you know what, I left the profession because I just couldn't take it anymore. I would come out, give the report, nothing happens. And the 2 homes, for folks who are watching, the 2 homes that lost their license, by the way, were not because of poor management of operations or what was going on. It was because of their financial mismanagement. So it really boggles my mind as to, have any homes ever been reprimanded, or have they ever faced any consequences for their for the horrendous behavior, for the way they have treated elders? And frankly, no. Go ahead, Teresa.
Well, I was just looking up an article I recently read. It was a retired, or somebody who resigned, actually, an inspector. We were talking about homes losing their license, who blew the whistle on long-term care homes, and they've kept their anonymity because they're worried about it. But what had happened is they said oftentimes they would be briefed before they actually went into the home, and quote unquote, these are friends of ours, or this is somebody that knows this person, so don't be too hard on them. So it was almost it wasn't almost like that they were being coached not to fully do the full inspection. And as we know, inspections were announced, right? So of course the homes would put on the best foot forward. But when you bring up the fact that, if only 2 homes have lost their license because of financial issues, it really drives the point that we need to make homes not for profit or municipally owned. All public dollars need to be publicly delivered when it comes to our most vulnerable population, and that being seniors, as we're talking about them. When you have, during a pandemic, as we've known, for-profit homes still paying out dividends to their shareholders, to their, how is that okay? That should be the money they should be spending on, infection control, hiring more PSWs or RNs or RPNs, ensuring there's IPAC control methods, ensuring that there's enough PPE for their workers. And so the inspection process that was happening under the Liberals, they eroded the inspection process. When I was, when I was first elected, we hammered the Liberals on the inspection process. And there was infractions and violations and non-compliance orders. And they had promised to complete all inspections of long-term care homes in a certain timeline. Of course, that went by the wayside. We pushed them to do it. They were called resident quality inspections. They're supposed to do them once a year. Well, the government watered that down, and this government has also even put more cuts into inspections. So the accountability and transparency has been eroded even more so around long-term care homes. And then come along the COVID-19, the pandemic. When we asked for a public inquiry into it, the government decides to set up their own government commission. Now, I have to say, at least some of the things, they're hearing from workers and families and medical professionals, and the commission has backed up the time to care, the 4 hours. So that is reassuring that they are not, glossing over what people are saying. But again, there's some documents that the commission has been asking for that the government hasn't given them. So again, the transparency piece when it comes to government. And when you say, to me, when there are inspectors that have been informed of the outcomes of inspections because of connections or friends of a friend, there's a flaw in the system and it needs an overhaul. And when there are compliance orders or violations, what we need to do is work with homes to make them meet those inspections, give them the tools. Because if we close down homes, where are those seniors going to go, right? But our model is a not-for-profit home, and that way there is more transparency under financial accountability.
Yeah, and you've just really highlighted the biggest concern here is that we need to have quality care spaces available for seniors. Many of whom have disabilities. I mean, people who end up in care homes are not there because they just they just want to live alone and appreciate a sort of institutional, which by the way is a huge problem on its own, is the way we have thought about long-term care, the way we really think about this sort of hospitalization of elders rather than really giving them a home. But when we talk about inspections, when we talk about the idea of enough staffing, all of these issues, I mean, the fundamental problem with it, when you cut down on inspections, when you cut down on the quality, when you cut down on staff, I mean, think about it. You're cutting down on the care, on the number of times you're going to get someone checking in on a loved one. You're cutting down on the amount of food someone might get. You're cutting down on a shower. I mean, I remember in 2018, I was, one of the things that I was just I feel like I was hitting my head on the wall because we just repeated these issues in Parliament so many times. We talked about the fact that sometimes a lot of our elders um, don't want to have don't want to be given showers by, let's say, a woman, resident living there. They don't want a shower, from a male PSW. And when they would refuse, they would be told, well, you know what, then you don't, too bad, so sad, you don't have a shower for that week. And that was the reality for loved ones that were in homes where they had no choice but to accept what was given to them. And talk, and there's the cultural, the traditional aspect of it, and the mental trauma that people would go through as well. I mean, if we're talking about their health, their mental health, um, I mean, that's not home. That's not a life to live. You're not doing. I mean, it's just, there's just so many things. And I think your bill, Teresa, really addresses one of the fundamental issues we're facing right now, which is, if we have enough staff, then we can solve a lot of these issues. We can make sure
You
that
know, I
go ahead.
go
Yeah.
ahead. No. Absolutely correct. I mean, 4.1 hours of care, it's not the first time it's been introduced. I think it's been introduced 3 times before by other NDP members, Andrea Horvath and Franz Schillina. And, what you just said is exactly correct. Many times, if we had addressed the quality of care and provided that care, it would eliminate a lot of these complaints. And it would eliminate, critical incidents complaints, inspectors going out to complain about quality of care. And we could use those resources and put back into the care where they should be. And families, I mean, there were so many complaints that families called, even, about quality of care ongoing, and nobody listened. And I think what I found frustrating in the legislature was when we'd be asking questions, when we'd be making statements, when we would be debating healthcare bills, and we would say, hey, look, I've got a call from a family member whose loved one was, their incontinence products, they weren't changed for a day. They weren't able to get that help. They were left there, and what you would hear sometimes as a response, and I heard this both from Liberals and more recently the Conservatives, they would say, well, the member across the way is just fear mongering. Honestly, that response, it was so disappointing, because even with the Conservatives, the Ford Conservatives now, many of those members served as opposition in the legislature when the Liberals were in government, and they were complaining about long-term care. So they know that the quality of care has been eroded for decades. And to say that people are fear mongering when they're bringing their voices of their constituents to the legislature is completely dismissing the actual problem. Successive governments have not admitted that there were problems. Previous to the COVID, there was class action lawsuits against long-term care homes about neglect, about abuse. Right? And it's not anything new. But what the failure is the governments have decided that they're going to ignore the actual problem and play political games with our loved ones. And that's what's happened over decades. So if we can get that 4.1 hours of direct care per resident per day, it is going to it's a small step, but it's so important, not just to the residents, but also to the workers who are working so hard. And right now, under the pandemic, they're exhausted. They've really hit a wall, many of them, but they're continually to push. And if you're going to attract more workers, you've got to have better working conditions, better pay. Absolutely. I mean, the ministry talks about changing the work culture and making it a great place to work, but people ultimately still have to pay their bills and put food on the table and pay their mortgages and send their kids to school. So, and it has to be an incentive to say, you know what, we value the work that you do for our most vulnerable seniors.
Yeah.
Our most vulnerable population. And it's mostly frail seniors, absolutely. But there are, other adult people in long-term care with various ailments, illnesses. And we have to acknowledge that, they are very, very susceptible to fragility, vulnerability. And the people that look after our loved ones, We depend on them for everything. The 4 hours of care is so crucial. Workers have said, I can't even sit with the resident and, have a small cup of tea and talk a little bit about their day. There's in the morning, I have 6 minutes literally to get all my residents ready and out the bedroom, out of their room, clothed, hygiene needs, and rush to the breakfast table. That's 6 minutes. I mean, I don't know if anybody else out there in the virtual world can get out of bed, brush your teeth, wash your face, comb your hair, style it. A lot of us style it and get dressed in 6 minutes and ready out the door. That's just a lot to ask for when you layer on the mental health, where cognitive issues, physical issues on a person who's 80 in their 80s, and asking PSWs to do that kind of work without acknowledging the valuable contributions they make to our loved ones. Ford governments, I don't hear him calling healthcare heroes as much anymore. I mean, the first wave, it was all about healthcare heroes, healthcare heroes. They still are our heroes, whether there's a pandemic or not. They've always done that work. And for us to continually not improve long-term care and deny them a good workplace with 4.1 hours of care. And you talked about cultural sensitivities as well. That has to also be ingrained into that workplace. So many, many things that have been a failure of this Ford government and successive governments before them, have just really pushed us over the tipping point. And if not now, when will a government in leadership take responsibility and fix the problem? Yeah. And I think I have to say that's what an NDP government is doing. We are ahead of what is happening in the pandemic, and we have been talking about the changes that needed to happen, and we are committing in our seniors plan, our seniors care plan, to those changes for the better. So the time to care, I've said we're going to have that 100 days campaign. It's just a continually pressure and making sure that we get the word out. We can do this, and no one can do it alone. So the more people that are behind pushing those issues, not for profit, absolutely put the money all back into front lines and look after our seniors.
Yeah, that's how we got it past second reading as well. And the other bills as well. There are 3 other bills as well that's in the House. The people that have come forward to support and push the government, the emails that went out, the phone calls that you have made, all of you out there in the Twitterverse, in every platform, a huge thank you from the bottom of our hearts. I think I remember the day the second vote was happening, the conversation and the huge mobilization that took place across different platforms, and that was all thanks to all of you out there. And I want to go back on the point that Teresa touched, which was about the healthcare heroes, the doctors, the nurses, the PSWs, who have been doing an incredible amount of work. And we know when these homes were facing outbreaks, and many of them right now are under the control of hospitals, who have now gone above and beyond trying to help, support, provide all the necessary resources. And just today, and I want to make sure that I have all the right. Let me just pull that out, the letter. Okay, so today we actually had a group of doctors who have come forward and released a letter. And Teresa mentioned our platform, and I want to say I was so delighted to see this letter, because all the things that we have highlighted, we've been calling on the government for. This letter, it talks about every single one of them and says, here is what we need. And I think it's a disgrace that the Ford government and the Minister Fullerton has sort of said there is no problem in long-term care, or that the condition is stable. I mean, she's described it in so many different ways that I think it's I don't even want to get into that, but I want to just recognize the doctors who are calling themselves, and they have a fantastic name, which is Doctors for Justice in LTC. Doctors for Justice in LTC. A huge shout out to all of you. I know Amit Arya, Nahid Dusani, and our good friend Vivian Stamatopoulos, who joined us just a few weeks back for another one of our sessions actually, and talked about long-term care and what's happening in tender care in Scarborough, who have actually joined along with over 200 other doctors, researchers, to call on the government to act, and highlighted this crisis. And one of the things we've described this crisis as is a humanitarian crisis. What's happening in our long-term care homes is a home humanitarian crisis. And anywhere in the world, what's happening right now, this would be categorized as criminal negligence if you didn't act to improve. The inaction itself is criminal negligence. And actually, can I just take a moment for all of you who are watching and ask Teresa to join me in wishing Dr. Vivian Stamatopoulos a very happy birthday. It's Dr. Vivian's birthday today, and I just want to say happy birthday to you. You have been an incredible advocate in the long-term care work that we've been doing, and we're just so proud to have you on this fight together, and we're just so proud of all the work that you do. So thank you so much.
Happy birthday, Dr. Viv.
And to all of you watching, make sure to send us a shout out to Dr. Vivian as well. Can I just take a moment to go through some of the things that's on the letter that the doctors have put together, Teresa? So they have highlighted some of the biggest issues, which is lessons learned from the first wave. And we know there were specific lessons learned from the first wave in terms of managing this and the rapid response that was necessary to make sure that we don't allow for the spread to happen. And one of the things they wrote was, in the first wave, the Ontario government managed the pandemic in a way that put LTC residents and staff at increased risk for COVID-19, with devastating results, while many countries had challenges managing the rapid spread of COVID-19. Canada had the highest proportion of LTC deaths as compared to other OECD countries. In Ontario, this resulted in almost 2,000 deaths. And folks, Canada we're one of the richest countries where, I'm privileged. I check my luck all the time. I'm so proud of us as Canadians. We live in one of the best countries in the world, one of the best provinces in the world, which is why we need to be doing better. We need to be doing so much better. In the second wave, they go on to explain in their letter is some of the issues that we have been talking about, which is poor infection control practices, something that we've been calling on from the first wave. I remember Teresa speaking in the House, in the legislature, right in the beginning of the first wave, beginning of this pandemic, talking about we need infection control. We need to make sure our homes are protected so that they don't even catch COVID. They talk about delayed responses to outbreaks in homes. We know for tender care, for example, the report when tender care and North York General Hospital wanted to work together, and North York General was going to take over, the actual application for it sat on the minister's table for more than a week. The lack of transparency is another issue. We still don't know what's happening in many of the homes until people come forward, family members come forward and highlight those. And we also don't know, how many deaths until one of the homes is forced to release it, and then the ministry's website is not updated for another day or two. How are they making policies? How can they even know what's going on if they don't have the right numbers that they're looking at? The letter also highlights the worsening staffing shortage, exactly what Teresa has highlighted. And finally, they talk about delays in improving staffing levels. In terms of some of the examples we've given, we've talked about, Alberta having a really mass training program. We talked about BC and Quebec. So they highlighted some of these issues, and then they go into some of the fixes, which is actually exactly what Teresa has talked about, and that's making sure removing profit from long-term care homes. And Teresa, I want to give it back to you before I go into some of the other actions they have called for, because they go into talking about removing for profit. They talk about use all powers and resources available to provide high qualified staff, minimum pay increase, talking about ensuring family caregivers. A lot of these are exactly what we need to protect residents right now and make sure that staff are well equipped. You highlighted a little bit about what staff are facing right now, and we've had 11 deaths already in homes. What can the government do right now, and what are we calling for in terms of making sure that staff are protected as well as residents?
And I think when we start talking about all the horrible issues in long-term care, I think you're absolutely right. The staff is so pivotal in the success. And so how do we look after the frontline workers in long-term care? And our platform has talked about it, and so has this letter from the doctors, which it's it's a bitter pill. It's bittersweet, right? Here we have COVID-19 exposing all the horrific things that have been happening in long-term care for years, for decades. But it's a good thing because now everybody understands, and everybody's fighting for those changes. So it's refreshing to have the doctors all sign on and be very aligned as to what we're calling for and what they're saying needs to happen. And we have, like I say, in our senior care platform, it's on our website, on the NDP website, and it says remove profits out of care and only have not-for-profit or municipally owned homes. We also say, on top of that, we go even further and talk about making homes more like home-like settings, taking out the big institutional kind of settings, making homes between 10 to 16 people so that it does feel more like a home. And that will also help infection control, right? And be more culturally appropriate as well. And the 4 hours of care so that people feel like it is their home. That is your home, and you need to be treated with respect and dignity in your home. And workers want to do that, but they don't have that 4 hours of care, time to care to give. The money that for-profit homes aren't putting back into the front lines, that they're finding ways to stretch that dollar more. All right. The full-time jobs where the staff need a full-time job. But now they were saying that it's not everybody needs a full-time job, because there are some people who want to work part-time, but there should be proportionality of the full-time jobs that belong in long-term care homes so that there's continuity of care. But right now you've got different PSWs, as an example, working different homes, because homes won't give them a full-time job, because that means benefits, right? And we need to have packages like for retirement. Mostly this is a woman-dominated field. And when women are working hard, there's high rates of injury as well when you don't have enough workers. So having those full-time jobs, keeping that continuity of care, it's going to improve the quality of care as well, right? It's going to mean you're going to see that same PSW every morning. Your grandmother who's in that home, who's in 85 and is frail, maybe has cognitive issues, she's going to see that same PSW every morning, greeting her, getting her ready gently and with love and with attention that the workers want to give. Because as much it's the home for the residents, it's also that relationship bonding that PSWs are just drawn to. They talk about, that these people are like an extended family member. They spend so much time with them. They get emotional, they get attached, right? So they want to spend that time. So giving that full-time job to give that continuity of care, making sure that they're paid and ongoing training. And we need to also have, our platform talks about geriatrics training. That's something that we need to have, right? So our population is getting older, and I talked about a little bit about that, how we need to gather evidence, we need to gather stats. These stats, we've known this wave of older elderly people were coming, and we haven't prepared for it. And one of the crucial parts we also need to take into account, and this government again talks a good game, is about home care. We need to ensure that people who need home care get assessed and get the right amount of care. Right now, people are not getting the right amount of baths. I mean, in long-term care, it's as bad, but they're not getting the care that they need at home, and which that expedites and escalates people's health needs, having to access long-term care, having to access beds, alternative care beds in hospitals, which we know is more expensive. So we need substantial investments to make sure that we have good, solid, sustainable home care for people who can stay there as long as possible. And that also means making that workforce a very sustainable workforce and attractive. Because if we're going to make long-term care, an attractive place to work, there's going to be a shift in workforce. People would want to work in hospitals if they get paid more. People are going to want to work in long-term care if they get paid more, not in community care and home care. And that's got to be also part of the plan, which we have addressed as well. And all those things compiled together will make, a society looking after our elderly proud, right? It'll make us proud, because right now it is shameful.
It is. It really is. And in the letter as well, they talked exactly about what you just highlighted, which is, why don't we pay? And this is some folks might be really interested in this. We actually don't pay the same amount to LTC staff as hospital workers, for example, for sometimes the same job. And we know how fragile or the needs that many of the residents have. So they go into highlighting the fact that we need to make sure that ensure that formal partnerships are established between hospitals and primary care teams, making sure that staff are recognized the same way, and all staff should be permanent and receive paid sick leave and benefits. Another bill that we're pushing for, Peggy Sattler has introduced that bill, and we're calling the government to bring back the legislature and pass that bill as well. And another thing that Teresa highlighted, which was keeping hospital or community-based medical team on standby, so that if something happens, you're ready to go with infection control, making sure there is basic care needs that are met. And I'll just add on, which is the point of having caregivers. So usually in many of these homes, you would have volunteers, but during COVID, you don't have that, which goes to show how drained the staff members were already, and undervalued. But the fact that many family members and many of these friends and loved ones who would go there to take care of their family members were critical, essential caregivers. And that's another bill that we talked about in the past, and we need to make sure that that value is given to the family members. And finally, the letter highlights something that we've been calling for, which is speed up the vaccination rollout. And I know folks who have been messaging as well, where you're frustrated as well. We are also, all of us in the official opposition are extremely frustrated at the way vaccines have been rolled out across the province, because we know in Scarborough, we need more vaccines. We have 3 hospitals that are already over capacity. We have many more essential workers than other areas. We have many more frontline workers who are out there getting infected, and they need to have the vaccine sooner. We cannot have an equal amount. We need an equitable amount. And seniors in home care, seniors in long-term care homes, healthcare workers, essential workers need to be prioritized. It's critical. There are quite a few, Teresa, comments that we have here, Teresa. And so if you'll go with me, I want to just share some of the comments that we have received. So Kim messaged and said, removal of the for-profit system must go. The Ontario government is sitting on their hands. And then Leanne messaged and said, thank you so much for the advocacy. And I just want to thank you folks who have been fighting hard against the for-profit system as well. iNoon messaged and said the overall response of government of Canada to COVID-19 is frustrating. The voices, and I completely agree with iNoon as well. I mean, we should have known better in terms of negotiating and having vaccines available and preparing as well. Teresa, you would be delighted to know that our team here in Scarborough is the healthcare team. They're ready to go to vaccinate 1,000 people per day. 1,000 people. We are ready to have a community clinic to vaccinate people and have the equipment, have the people ready, and yet we don't have the vaccines.
Yes, and you know what? That has also happened in London. They're expecting to vaccinate, first phase, they call it, which is long-term care and high-risk retirement homes in different areas. But we had the Agriplex ready to go to have more vaccinations, and they had to shut that down early. The government needs to step up the vaccinations. They have, I think they have received over 400,000. I can't remember the exact number, but it's literally over 400,000, quite a bit, over 400,000. And then they've only vaccinated, I think it's 280,000, 280, not quite 300,000. So there's really this process that they could speed up vaccinating seniors if they're, as we all know, they're the most vulnerable, the long-term care home staff and seniors and residents in long-term care. But there's communities like yourself. They have good resources. They have professionals ready to put the vaccines in people's arms, and it's been stalled. And so it's upsetting because every day when people tune in, there's a different scenario, right? Yeah. And it feels like people are just discouraged when they hear, here's the plan, now it's changed, and so it's like they're promising things and then they have to always pull that back. And people are just becoming frustrated and discouraged, and they want to see, this rolled out quicker. And the government has, like your community, Dolly, like you say, you guys are ready to go. They've let communities down when it comes to that.
And the fact that they're sitting on money which has been allocated for COVID but hasn't been allocated for specific needs of these different communities. In our area we have we're considered ground zero for COVID because we have the rate of infection is so high. So when we look at the average for Ontario, which is just above 6 or so, which was last week, and I mean we're above 20 now in many neighborhoods across our area. And it is, you're right, it is getting, when we give people the recommendation of staying home and following the guidelines, we have to work with people as well. We have to work with community members. We have to support them and make sure that we do our part as representatives. It is a duty that we serve. The work that we do have to make sure that we're working with the community to support them in times like this. I want to go back to what Voices of Long-Term Care has commented as well. Maureen McDermott messaged and said, thanks for doing this. Voices of Long-Term Care will be participating in the town hall and we look very much forward to it. Kim messaged and said, it happened to my mom. I think she was talking about one of the issues that she's dealt with as well when we're highlighting what's happening to, in a specific treatment like showers, for example. In June, actually, June Morrison wrote, Google Orchard Villa with my surname, and you will find many news articles of George Morrison, my deceased father. And I have actually seen a lot of the information about that, and I've seen what's happening in Orchard Villa. And I remember both of us actually talked about this home just early in the pandemic when we were called back for the emergency session. I specifically talked about Orchard Villa because of what was happening to another constituent of ours, a Scarborough Southwest resident, Matt. Smith Johnson, who lost his grandparents, and one of them was in Orchard Villa, and the horrible treatment that his grandparent went through. Patricia Ann messaged and said, we also need to improve funding for in-home care. Absolutely agree. Teresa agrees. Yeah. Home care all should include long-term care, nursing homes, and in-home care, safety of elderly in transfers in between hospital transfers from London high care to low care, and lack of knowledge of those working in uh, I think there's a little bit of the comment is lost here, so I think she was just talking about how they're being moved from one space to another, especially from hospital to long-term care. And we've actually heard that many folks who are coming back from hospitals were not allowed to come back to the homes because they didn't have enough space to isolate them, or sometimes they were coming back but they didn't have the proper transportation. So if they were either, they were exposed in the taxi or the transit they were using, or they may be exposing themselves to others who may catch the virus. Faria Kibria messaged and said, we can improve funding for the long-term care homes, including a raise to daily food budget, employing more housekeeping staff. 100%. Recently, Teresa, I think we were looking at a picture that a family member posted about, which was the amount of food they're given, their mom was given.
Yeah.
I I I think, like, as government who has a majority government, or anybody in power.
Yeah, the food quality, and I saw that as well. It was in a styrofoam container, and
The one hot dog and the bread.
yeah, like it's just to think of what loved ones in long-term care and what the staff are going through, and horrific stories about people calling for water. People not being, their continence products not being changed, they're not getting fed. I mean, and then to see the quality of the meal that's coming.
Yeah.
I mean, I can't imagine what people must be going through, not being able to, interact with their loved ones like they used to. And even communication. Some long-term care homes, I've heard a lot of this. Some at the first wave, some of them were not communicating at all with the loved ones, family members, to find out. They didn't know what was going on. And some of them were better than others. And that's another piece. When there are things, when there's a lockdown and, they were restricting people, there need to be much better communication so people knew the state of what was happening. And unfortunately, we didn't get that until the Canadian Armed Forces went in and revealed all that. And now with long-term care who are in situations where they need help, I know Dr. Vivian yourself have been calling for the Canadian Armed Forces to be called in to help homes, for the Red Cross to go in and help. I mean, there shouldn't be a question about it. It should be done when there's a horrible outbreak. I remember early in the day was Bob Cajun, the Bob Cajun home.
Mhm.
At the first one, that's when they first started. I remember the horrific numbers. But, it hasn't changed under the second wave, right? The numbers are still there. The outbreaks are still happening. When the minister, I understand her definition, it just takes one person for an outbreak. But, it's when there is that one outbreak, I think everybody's on pins and needles, because we know that if the way the infection control processes, the age of the home, whether there's enough PPEs, whether there's enough workers, they're in such a vulnerable state that it can spread so quickly. The peace of mind that people, I think, expected the government to learn the lessons from phase one, to implement them, it didn't happen over the summer. They didn't do their homework and start a real rigorous hiring plan for PSWs like other provinces did, right? It's just completely discouraging.
I want to share, if I can, actually, of somebody, one of the I think wordsmiths shared shared a picture of the and Maisha's.
Of the meals, yeah, that's the one that I saw too, and I thought, oh my gosh, there's no nutritional value. There's nothing appetizing about that. You use your senses to salivate, to want to eat a meal. Smelling that, I'm sure, wouldn't motivate anybody. I mean, that isn't even acceptable in today's standards in a rich country, in a rich province like Ontario.
How
How
are you helping the immune system? Like, is there real nutritious value in this food? And imagine giving that to, like, in your home. Imagine giving that to your mom or dad. Like anybody who's serving that.
I
I mean, shareholders, all the people who got their hundreds of thousands of dollars payout um, for this. And thank you, Misha, for that.
I have a constituent of mine who lives in a home, and she's a wonderful older lady. She's a resident, and I won't divulge her name because I don't have permission, but of Italian heritage, and been complaining about the quality of food, and that cultural piece that we talk about. I wish, the NDP has said culturally appropriate meals, events, ceremonies, the diversity piece. And to have those things to accommodate people, especially when they're in their golden years, it would be wonderful, right? And I don't think it takes a lot to do that, but to see the meal that's being provided now and what we can see in the future, like it's so far apart. And that's why we need an NDP government, because we are going to put a priority of our elderly people, our most vulnerable people in long-term care. We make, when we put that in writing and when we have that senior care plan, I know that our leader, Andrea Horvath, is going to deliver that, and our critic in long-term care, myself at this point, looking to make those things happen. It's just not words; it needs to be action. And the government talks about their staffing plan, but again, it's been delayed upon delay to implement. There isn't any money tied to a wage increase in that plan. And that's one of the things that they have to acknowledge from all the work that's been done during the pandemic by healthcare heroes. Surely that would be something that would be on their priority list to say, you know what, in order right now, the reputation for becoming someone wanting to enter a long-term care home is damaged. It's terribly damaged, and it's been damaged for quite some time. So, making the workplace better, of course, training, paying for their education. But then once they get there, they need to have proper wages because they are looking after one of our most precious, precious gifts, and that's our loved ones in those homes.
Yeah, it's and one day we'll all end up there in some form. And I just look at it as something that it could be, my parents. I had my dad who went through rehabilitation and had PSWs who became like family members, and the care that they gave him, he can walk again because of the caregivers that he's had, and because of my mom who became his essential giver. And it's when I look at an elderly who has a disability or who has dementia or who has any need, um, if we abandon them, then we're taking away the motivation for them to get up. And the amount of people who have now, sometimes we've seen the pictures of them, some looking out the window. There are some protests that we have joined where now the window curtains are not even open anymore because they don't want people to look out the window because of these pictures. I just want to go back and say, you got to get rid of the for-profit system. This has to be about care. It has to be about care. We're talking about people. We're talking about the care of human beings. You have to make sure it's about care. I have here others who have joined in. Lens Livingstone a message and said, thank you both for fighting on behalf of the long-term care homes along with the other NDP members. Thank you, Lance. Big shout out to you for always joining our lives and commenting. Kim also messaged and said they're not accountable for the money they receive. Yeah, absolutely. The for-profit homes and the shareholders, it has become about profit, which is why myself, Teresa, all of us in the NDP, and the many, many doctors, we know over 200 doctors who have signed on to this letter today, are calling for the end to for-profit homes. We have also talked about, we actually have another comment from Beth, who joined and said some are psychiatric patients that were given their rights to take them out of the institutions. And I think this is when we're talking about the fact that the surrounding of these homes and that need level of need that they have. Leanne messaged and said, is there anything a person can do to help? If we aren't a PSW or nurse, just because we care. And I think this is something that we can. There's a lot you can do. You can make sure that you join all the work that we're doing, and the doctors are doing, and push the government, push the minister. Continue to rally them, because the way we got to the first and second reading of Time to Care Act, for example, is because people have come forward and fought for it. And we will make sure that we keep fighting for it. I know Teresa's ready to go back to the legislature so that we can have the third reading of this bill passed.
Yeah, absolutely. Time to Care, I mean, it's very well titled. It's overdue that there's time to care. And the fight needs to keep happening. Call your MPPs, sign petitions. If there's a rally, right now we can't obviously, but when these things aren't, when COVID isn't here, having those meetings with your MPP, even picking up the phone now and calling them and saying, look, get the legislature back and pass these very important bills in order to ensure that our residents going forward in the future have that 4 hours of care. That needs to be done. We cannot keep kicking the can down the road and hoping that nothing, happens. It's going to happen. It's a perfect storm waiting to happen, right?
And we can't wait for 2024.
2025. Yeah. That so many lives can, depend on that 4 hours of care in a quality setting.
Yeah. Yeah, absolutely. We're actually just over time. So I want to I appreciate all of you who have been commenting. I will try my very best to just go through them so that Teresa has a chance to respond. And then we'll have to end for tonight, but we'll definitely be back again with our new normal series talking about issues like long-term care. So make sure to tune in then. Beth messaged as well and said staff to resident ratio needs a mandate, and I think this Time to Care Act addresses that. Institutions need to be broken down and out to provide quality care, not quantity, crowding our vulnerable seniors into a common home with no privacy to save on money and resources. Absolutely. I mean, the reason why they are not able to isolate anymore, and what's happening in terms of the crowding and the lack of staff, all of this is the problem, Beth. And I think you highlighted in one sentence very well. Ward Smith joined and said, a profit motivated society regards retirees as a cost. And right now, people are making profit on the backs of these elders.
Those are all valid comments, all valid comments. I found the numbers about how many vaccines that the government has. It's 411,650, and they've delivered 280,573. So that means they still have over 130,000 doses in the freezers that need to go out there into our most vulnerable population and get them vaccinated. So again, thank you so much, Dolly, for continually representing the people in your riding so well and so strong, a voice so strong. This government needs to be, pushed into many decisions they make, and kicking and screaming at times. But we need to keep doing that. We need to keep pushing them and putting that pressure. And right now, the tools that we have is Zoom and Facebook, all the virtual tools that we can put up on social media. And there's more people joining the cause when it comes to changes to long-term care. And I just want to thank everyone for all their efforts.
Absolutely. And thank you very, very much for joining me and for the work that you've been doing for so many years, fighting hard for all our seniors. And thank you for fighting for London-Fanshawe. I know they're lucky to have a representative like you, Teresa, and absolutely delighted to have you join us virtually. I'm always learning from you about long-term care and so, I remember in 2018 I had a constituent who reached out and told me about her brother and what she was going through, and the treatment that he was getting. And eventually she did lose her brother and in really unfortunate circumstances. And it was just one of the most devastating stories I think we talked about. And I remember, you showed me some of the ways I could help, or at least try to navigate the system to find different ways we can help our local residents, which is what we've been doing in our team's been doing. And for folks out there, if you're having trouble, if you are trying to get your loved one out, if you're trying to find out what's going on, or if you want us to, anonymously leave all the personal information that because I know some loved ones, some family members don't want to share or come out openly because they're worried about their mom or dad being treated badly in homes. If you want us to do that on your behalf, we'll be happy to. Don't hesitate to reach out. I want to thank you all for joining me. I hope I went through all the comments. If I missed anyone, I will try my best to go back and see it later on. But feel free to reach out to our office anytime. Send us an email, comment on our social media, and we'll do our best to raise your concerns to this government. So once again, thank you so much, Teresa. I really appreciate the work that you're doing, and come back again to Scarborough, hopefully in person. I can't wait to get out of this pandemic.
Yeah, thank you for the invitation. I'll probably take you up on that. Have a nice evening, everyone.
Absolutely. Thank you so much, everyone. We'll be back